For Action News, I'm Anna Dulosky. Which chemotherapy drugs are better at treating any given cancer? The answer hasn't been so simple, perhaps until now. One solution could partially eliminate the guessing game, using mice to test for different chemotherapies. One possible method, a tumor injected into a mouse with an immune system that has already been compromised. The tumor is then treated with potential drugs that could stop or eliminate the tumor. The method is an alternative to using cocktail drugs on humans without knowing whether that particular combination will work. Here's ACTIA's Dr. Josh Bloom with more.
The staple of oncology research, the animal model at least, for a long time has been any number of varieties of immune-compromised mice. And they're called skid mice, they're called nude mice, and it depends on how much immune system, if any, they have. The problem is if you just take a regular mouse and a piece of a human tumor and you inject it under the skin on the back, there's an immune response because the mouse recognizes it as a foreign body and the immune system of the mouse will destroy it. For this reason, it was really important to develop mice without immune systems. What they're doing now is they're using these same mice. Instead of implanting a standard lab tumor and trying experimental drugs to see if it'll shrink it, what they do is they take a piece of the person's own tumor and they implant it under the skin of the mouse and it grows. It takes about 3 months. And then instead of using yourself as a lab rat to see which of the regimens might work, you use the mouse. And it's very clever, and there are only small studies so far, but it seems to have something there. Some of these chemotherapy regimens are really hard to take and they're really toxic. And if you're taking one and it's not doing your cancer type any good, then you're basically poisoning yourself for a few months. And sometimes people get so sick that they can't take another chemo regimen. For stage 4 colon cancer, there are about 40 different regimens that you can select from. So which one do you pick? Who knows? Different labs will use different ones, different hospitals will use different ones. So if you can take those 40 colon cancer cocktails and narrow them down to maybe 1 or 2 or whatever, then you're really increasing the odds that you're going to get some benefit for the patient and you're going to avoid some toxic chemo regimens that aren't going to help anyhow. The drawbacks are that it takes a few months for the tumors to grow, and then you have to test your drug cocktails on each mouse. And during those 3 months, you're not getting chemotherapy, or you're getting just something that's plucked off the shelf. It's also expensive, and its predictive value is good, especially in the negative sense. If the therapies don't work in the mice, they don't work in humans. If they do work in the mice, they usually work in humans. So there's shortcomings here, but it's a clever approach, and I think what this is leading to eventually will be, instead of using mice, they'll be able to use cultured cells.
To read more on this story and others, you can head to our website, actia.org, and while you're there, don't forget to also sign up for your daily dose of news delivered straight to your inbox. For Action News, I'm Anna Dulosky.